afternoon, everyone. Excuse me. My name is Sandra Melstead, and I'm a consultant with SLM Consulting, and I work with the South Dakota Department of Health. And we've worked to put together a learning collaborative that you have all registered to join. So today is the first in a series of 4 webinars that have been put together to really focus on looking at that, bridging the gap and really collaborating between public health and healthcare, and really looking at opportunities to help build the capacity of our public health workforce in South Dakota. And so today we have Timmy Johnson, who will be providing information around for our first webinar. And Timmy Johnson is a health sciences librarian at the University of South Dakota. She has been at USD since 2010 as the liaison to the School of Medicine and many other health sciences programs. She has received her Master's of Library and Information Science from Dominican University in River Forest, Illinois, and her Master's of Public Health from Des Moines University in Des Moines, Iowa. Before I pass it off to Timmy, just invite you all to mute yourself while she's speaking today on Zoom, and also encourage you to use the chat function if you have any questions that you want to ask of her throughout the session, and we'll be able to address those at the end of the session. We'll have some time for some Q&A at the end of the session. And then there will also be an evaluation that we'll be sending out to you after today's session. If you did register for the additional sessions within this learning collaborative, you should have received a link to those in your calendar invite with the Zoom access for those. And I will touch more on those at the end of the session. So with that, I'd like to welcome Timmy and invite her to share her knowledge and expertise. So thank you all for joining.
Thanks, Sandra. So like she said, yes, my name is Timmy, and I am health sciences librarian at the University of South Dakota. And today we're going to talk a little bit about assessing and finding evidence. So I'm going to go ahead and turn off my video because I always feel kind of silly when you can see me over my PowerPoint. So if you want to just go ahead and minimize me all the way, that is absolutely fine. That's my plan for myself anyways. Okay, so our objectives for this session are to identify the differences between seemingly valid websites and reliable resources, and then learn where to find authoritative information. So the first thing that we kind of want to talk about when we talk about finding evidence, it's just being cyber skeptical, I guess is what we call it. So you want to consider the source of your information, who's responsible for your website, is there contact information available, and then look at the extension to decide how much you might trust that information or not. You also need to focus on the quality of the sources. So what is their review process? What's their editorial policy? Who supplied the information, and then make sure that you are aware of bias. So if a site has a lot of advertising, depending on who funded it, that type of thing, you just really just kind of need to take a look and be aware of that sort of thing. I know that we all kind of know that Wikipedia is not a great resource and not a good place to find evidence, but I like to go over it anyways because it's a really good example of how inappropriate, or not necessarily inappropriate, but how much it maybe is not a reliable resource. So obviously, you know, it's great for looking up famous people, countries, general background information, but still anybody who would like to can make any changes in it that they like. And even though they've gotten better at policing it, sometimes those changes that are incorrect stand for quite a while. And then you definitely don't want a patient using it. So this is why we definitely don't use Wikipedia. Here's my example. So it's the Wikipedia entry for Marfan syndrome. And this section talks about the cardiovascular system, which is a very important system that is affected by Marfan. But there are no citations in this section. So where did this information come from? You really have no idea. And then at the end, there are 55 different references which looks pretty good. You know, you think, oh, well, there's 55 references, you know, that's pretty good, even though the citations weren't necessarily in the cardiovascular system. But there's a lot of problems with these citations. So over 60% of them had some different issues in them. The resources marked with the X's are not peer reviewed. There's a press release in there. There's a consumer magazine in there. One of the journals ceased publication and the article is in French, which is obviously not helpful if you can't read it. The books that are cited in there are extremely outdated, one of them by 5 editions. So even though this Wikipedia reference section looks really good, if you look a little closer at it, it's really not. So you have to really be careful when you're looking on not just Wikipedia, but any sort of site, and you see, oh, look at all these references, that looks really great. That may not necessarily be as great as you think it is. Okay. So when we use Google, there was a study published on the credibility, accuracy, and comprehensiveness of information on lower back pain found on the internet. So when they found, what they found was that over 50% of the websites that they found basically Googling lower back pain provided inaccurate information. The comprehensiveness of treatment recommendations was very low across all types of lower back pain. Only 28% of guideline recommendations were correct. And then for radicular lower back pain, only 16% of guidelines were correct. So we want to talk about levels of evidence, right? So when you're searching for evidence-based information, you want to select the highest level of evidence possible. So a systematic review or a meta-analysis, you know, they've been systematically searched for, they've been appraised, they've been summarized, all of the literature for a specific topic. However, as you move up the pyramid, fewer studies are available. So it is important to kind of recognize that high levels of evidence might not exist for your particular topic or question. So if that's the case, you need to move down the pyramid if your quest for resources at the top is unsuccessful. There's nothing wrong with using case reports or case control studies or anything like that if that's the highest level of evidence that is available for your topic or your question. So when we talk about finding evidence, we don't just necessarily talk about like Pubmed and finding articles. We also sometimes talk about authoritative websites. And when I talked about that being cyberskeptical, we also talk about, you know, evaluating various websites. But these are all very good authoritative websites that I always show my medical school students at the beginning of the year. And the South Dakota Department of Health is on there. The National Institute of Health, Medline Plus, which is great for patients and families, clinicaltrials.gov, the CDC, the WHO. Those are all good websites for authoritative information. But we're going to talk about finding evidence at this point. So what is Pubmed? Well, Pubmed is a database that's produced by the National Library of Medicine. It has more than 32 million citations, and it provides free access to Medline, which is a citation database that has over 28 million references back to 1966. So Medline is a part of Pubmed. And Medline is where you can go in and search very systematically and very easily in Pubmed. So here's a quick example of a research question that we have, and that is, does telemedicine monitoring improve outcomes in chronic heart failure patients? So here's my little Venn diagram. So we have telemedicine, we have chronic heart failure, and we have health outcomes, and where they all converge in the middle, those are the results that we want. So we want our articles that we find to contain all 3 concepts in their content. So there's different parts of a search strategy when you are searching in PubMed. There is what we call controlled vocabulary, which is like a master list of topics in a database. It helps differentiate ambiguous meanings or spelling variations like British versus American spellings. It provides a consistent way to locate articles on the same topic when different words or phrases are used for the same concept. So for example, heart attack is the controlled vocabulary for that term is myocardial infarction. The controlled vocabulary for cancer is neoplasms, that sort of thing. And PubMed's controlled vocabulary is called medical subject headings, or MESH. MESH is applied by skilled indexers. So they go through all of the different articles and assign the subject headings to the article. And it is updated annually, and there's over 28,000 different descriptors to help you search Medline. Okay, so let's pretend that each circle represents an article in a database, each of these circles here. And the articles all use different terms. So the orange dots articles all use telemedicine. The navy blue all use telehealth. The gray all use eHealth. And there's one purple one down there that uses mHealth or mobile health in their article. Now, the controlled vocabulary term for that, or the MESH term, is telemedicine. So if you go into PubMed's MESH database and you type in telehealth, it will tell you that telemedicine is used for telehealth and eHealth and telemedicine and mHealth. So that would be your controlled vocabulary term for searching Medline or searching PubMed. Okay. There's another part of your search strategy that's going to be your keywords. And your keywords are all different ways to say the same thing. So it is especially helpful when there is no controlled vocabulary. So if there's no MESH term for your search, and it catches, one thing that it does is it catches new articles that might not have been indexed with your controlled vocabulary. So the newer articles take a while for someone to assign all the MESH headings to them. So it might not have MESH headings yet, or it could be in the part of PubMed that isn't in Medline, which is more life sciences based items, but there are some public health, medicine, allied health type of articles that also are not indexed in Medline. And the keywords, when you put them in, they have to appear in the title, abstract, or another text field in the citation record, so they can often be found anywhere. Okay. Here's some notes on keyword searching. So this is where it can be helpful to use various items. So British spellings and terms, pediatric, you know, there's they have U's in places that we don't, in spellings, that sort of thing. You can use, there's alternate spelling, so healthcare is one word or healthcare is two, different terminology for drugs. And then there's acronyms, so we have ECMO, ICU, ACL, CHF. But when you are using acronyms, you have to be careful. For instance, like WHO just makes the word WHO, or the OR for operating room just makes the word OR. So you have to kind of watch out when you are doing those. You don't definitely want to search OR in PubMed or in any sort of database that you might have access to, because you're not going to get what it is that you are looking for. So your best practice in searching is using both keywords and controlled vocabulary to get the best search that you possibly can, to get the most results that you can. So why use controlled vocabulary and keywords? So I said some of this before, but the newest records have not been indexed with controlled vocabulary or MESH terms. Some records never get indexed because they're outside of the scope of Medline. Some records never get indexed, but do have a title and abstract that you can search using keywords. And then some records get indexed and have a title and abstract, so you would capture that with both the keywords and the control vocabulary. And then some records never get indexed and have no abstract, but they do have a title, so you can search the keywords that way. All right, there's another part of the search strategy that is field tags, truncation, and phrases. So Pubmed uses what's called automatic term mapping. And Pubmed maps keyword searches to mesh terms, but it doesn't always do what you expect. So it can be very, very helpful, but if you look at this example, which is nursing, nursing maps not only to nurses the mesh term or nursing the mesh term, it also maps to breastfeeding mesh term. So it will search breastfeeding as a mesh term, and then it will also search breastfeeding in all of the different fields. So the title, the abstract, any other search field. So you just kind of have to be careful with that and check your search details. A lot of times automatic term mapping is great and it works perfectly and you don't have any problems with it. But for certain things, you kind of have to be careful. So if you're doing a search and you're like, oh, why am I getting this? It's not making sense. You need to go back and you need to check what exactly is that Pubmed is searching. And I will show you how to do that at the end of this PowerPoint presentation. I'll do a demonstration. And then we have field tags. So field tags, they help just to increase the precision of your search, to just showing what part of the citation a keyword or phrase that you're using should appear in. So if you use TW for text word, it includes all of the words and numbers, mesh terms, mesh headings, secondary sources, corporate authors, all the other terms that are possibly included in that citation. Title is pretty obvious. It searches for the title in the title, and the title abstract searches for words included in the citation's title, collection title, abstract, or other abstract, and the keywords in there. TIAB, title abstract, is a very, very helpful tag to use when searching for keywords. It's a good way to turn off the mesh automatic term mapping and ask the database to only search in the title and abstract. Okay, so truncation and phrases. So you can use an asterisk to search for many variations of endings or single plus plural for your words. So if you type in vaccine without the E and you put an asterisk at the end, you will be searching for the following. So you'll be searching for vaccine, vaccines, vaccination, vaccinations, vaccinate, etc. There are a few rules that you need to know about truncation, and that is that you have to have at least 4 characters before your asterisk, and it must come at the end of the word. And if you're using a phrase, it must come at the end of the last word. So for iron deficiency, you'll see these are our different options: iron deficiency, iron deficiencies, and iron deficient. We can just do iron deficient and then put the asterisk at the end, and we will capture all of these different options. So truncation can be very, very helpful. I use it a lot in nursing. So you just NURS, asterisk, and then nurse, nurses, nursing, that sort of thing. And you can use truncation in just about any database. You can use it in Pubmed. If you happen to have access to the cumulative index of nursing and allied health literature, you can use it in there, any EBSCO database, anything like that. All right, and our last part of our search strategies are Boolean operators. So Pubmed uses the Boolean operators and, or, and not, right? So and will find both of your terms, or all of your terms, whichever ones you're looking for. Or we'll find either term. So you would find, you can use it between synonyms to create a search concept about one topic. So the example we have here is biomedicine, biomedical, or biomedically. If you truncate it, you could do biomed and your little asterisk at the end, but it would find all of those different variations and when it would find everything. And then not finds one term, but not the other. So you need to be careful with this one because you may end up excluding important articles. Sometimes when you use not, things that you are looking for accidentally get excluded. I generally don't use not unless I absolutely have to, because it gets to be very iffy. So putting it all together. So here's kind of a visual of our Venn diagram from earlier. And so what I did was I looked up the mesh term for chronic heart failure, which is just heart failure. And then I added some keywords. So I added heart failure as a keyword in the title and the abstract, heart disease, chronic heart disease, and chronic heart failure. And I would search all of those with or. And then I did the same thing with telemedicine. So I looked up telemedicine, and then I did telemedicine, telemedic with the asterisk in a title and the abstract. So telemedicine, telemedicines, that sort of thing. Then I did mobile health, mHealth, or eHealth, which were all synonyms or keywords that I had looked at before. And then for health outcomes, I had to do a little more digging. It's actually outcome assessment, healthcare for our controlled vocabulary or our mesh term. So when I just put in health outcome, I didn't quite get it. So I had to put outcome, I had to put healthcare outcomes before it pulled up outcome assessment healthcare. But so then I added health outcome and outcome, and I put asterisks at the end of both of those so that I would also get outcomes. Okay. So this would be our search strategy. And this is why you don't use OR when you're searching for operating room, because Pubmed uses OR as an operator to help you put your search together. So this is what my search strategy would end up being. It would be all of these different terms for chronic heart failure, and all of these different terms for telemedicine, and all of these terms for health outcomes. And this is what it looks like when you're done. Now it looks kind of scary, but really all it is your, if you put it together slowly and you put it together in, say, a Word document, say, okay, I want heart failure or heart disease. And then you put, or them all together, and then you add your and you add your telemedicine part, you add your and then you add your health outcome part. You have the whole thing up there very nicely. So I will show you what that looks like in a bit. I'll show you what the recall for that is for the articles. So accessing articles. Articles in Pubmed will have a note if they are freely available. It will either say free article, where the articles are made available by the publisher, or free PMC article. This is where articles are indexed and freely available in Pubmed Central. So Pubmed Central is really great. It has about 6 million total records. It has author manuscripts. It has just digitized content from any NIH funded articles, those have to go in there. And then there's some PubMed Central journals and publisher programs that they have available. And then accessing articles, your local library, etc. So PubMed has a lot of freely available articles in there. However, your local library might provide an interlibrary loan service. Interlibrary loans, a service provided by libraries whereby they borrow you an article you are looking for from another library and then provide it to you. Often your local public library will offer that service, and it is generally free. Sometimes there's a nominal fee for it, just depending on your library. If you live near a college or university library, they are often open to the public. They may have the articles that you are looking for, or they may also be able to interlibrary loan articles for you, depending on their policies. And then the South Dakota State Library is also an excellent resource, places to get articles from. Okay. This is my contact information. I'm going to go into a demonstration right now of in PubMed. So I think I only shared my PowerPoint, so I'm going to stop my share for a moment. And I'm going to reshare my entire screen. Okay. And okay, can we all see the pubmed.gov?
Yes, looks good.
Okay, thank you. Okay, so there was that very long string that I had in there that I now closed, which was silly because I need to copy and paste it. Because I want to show you, but I don't want to type the whole thing back out because I put it all together and it's a pain to type it all back out. But I'm going to show you the differences. So this is my big, long, fancy search that I put together. And I get 658 results. This is asking me if I meant health. I didn't. I did mean mHealth. So I'm not going to worry about that at all. And yesterday I got 655 results, and today I am getting 658. Now, this is if you're doing a big search, like if you want to do a systematic review, like you want to do one yourself. This is probably the biggest, broadest search that you can come up with. Or if you are doing a very in-depth literature review type of thing, this is what you're going to want to do, and this is how you're going to kind of go about it. But I can show you how good PubMed's automatic term mapping really is, so that you don't necessarily have to do all of this if you are not looking for big in-depth. But I feel that it's important that you understand the process and your options before you just kind of go in and like guess. So I am going to go ahead and type in, I'm going to type in a couple of different things. I'm going to start with heart failure and telemedicine and outcomes. And I'm going to search that. I get 523 results. And here you can see there's this free article right here. So that one would be freely available to you. But if you go into your advanced search, this is where you can find those things where I said, you know, if you type in nursing and you accidentally get breastfeeding, this is where you can find that that may have happened to you. So we'll just go ahead and look at our search details. And this tells you, so I put in 3 different terms: heart failure, telemedicine, and outcomes. And this is what PubMed actually searched. So it mapped heart failure to the mesh term. It mapped telemedicine in the mesh term. And then it just searched outcome in all fields because it didn't map to anything. So it didn't automatically map to outcome assessment or anything along those lines. Now, if I do this slightly differently and I do heart failure and telemedicine, and I'm going to do outcome assessment because I know that that's an option. And I'm going to go ahead and search that. And then I get 249 results. And that's quite a bit less. That's easier to go through. It still might be a bit too much for some, but it might not be. You'll notice there's a free full text. So there's 101 of those. I'm not sure if that's an option in all of them. I have what's called a My NCBI account. So I'm logged in. You can see up here, and I know like this randomized controlled trials filter is my own. And so is the New England Journal of Medicine, Lancet, and JAMA. But I think you find the free full text filter in there all the time. So that's kind of a nice, easy way to find what PubMed has freely available online. Okay, so let's go back to our advanced and look at our most recent search. Okay. So this one, actually that's not the most important part. This one went with, when we put in outcome, it searched all of this, as opposed to just when it had just searched outcome and outcomes. So it searched for outcome assessment healthcare, searched for outcome and assessment, it searched for healthcare outcome assessment. So it really made that a much more specific type of search as opposed to just outcome and outcomes. It searched for specific types of outcomes. So let's go back to pubmed.gov and let me show you where to find the mesh database. So you just scroll down a little bit and it is right here. So all you need to do is click on that. And this is where you can look and see if a mesh term maps to your term that you're looking for. So I'm going to type in chronic heart failure because that is what we're looking for in the first place. And you'll see that it maps to heart failure. And if we look down here, these are all kind of the different terms that would make you map to heart failure. So if you typed in cardiac failure, it would map to heart failure. If you typed in myocardial failure, it would map to heart failure. Congestive heart failure, left-sided, right-sided, decompensation, all that sort of stuff will map here. So PubMed would make a little search for you. So it would search for chronic and heart failure as a mesh term. You can do that, or you can just add this to your search builder and search just for heart failure as a mesh term. So you have a couple of different options. If you want your results to be as minimal and as specific as possible, and you're not worried about maybe excluding some things that you're looking for, you might want to do just mesh terms. So you might want to do just heart failure. And telemedicine. Let's grab that one. an outcome assessment. Whoops. And add that one. So these three are all ANDed. We're going to search PubMed and we get 148 results. Easier to go through than 249. But this is only searching Medline, and it is only doing a very narrow type of search. However, it can be very helpful if you really are just looking for something very specific, or you only need, I don't know, say 3 to 5 articles for evidence that you're looking for, that sort of thing. So I talked a little faster than I had intended. And that is all that I have. So does anyone have questions?
Thanks, Timmy.
Yeah, you're welcome.
Appreciate your expertise in sharing information. While we still have you on, and I know we still have a good number of folks on the call, we do intend these learning collaborative sessions to be provide some expertise to you and help you understand, if you don't already know, how to find that evidence-based information. So I would invite you to, if there's any questions you have for Timmy, or if there's any examples that you maybe could share with folks, if you're willing to show yourself on camera and speak up, we'd like to allow this time for people to be interactive and have some opportunity to talk amongst themselves as well. But this is certainly an area that we've heard in some of the work that we're doing through the chronic program and working with partners is how do you as public health professionals and clinicians find that evidence-based information to really help drive the work that you're all doing. So so I just invite you to use the chat or take this opportunity to share some examples or ask some questions while we're still here. Timmy, I'll ask a question of you while folks are maybe thinking, but we talked with you before, but one thing that we hear a lot from people is how do you, and I think you shared some great resources, but how do you find access to research articles? One thing we see in the literature a lot is how it's important to kind of find those partnerships between public health organizations and universities and find ways to really help to share and drive that research and evidence-based information. So do you have any additional tips and things that beyond what you shared, or things that could help some of our participants here today to kind of help support the work that they're doing?
That's a good question. Sometimes, you can contact your friendly neighborhood public health librarian. I'm always willing to help in any way that I can, whether it's the people on the USD campus or the general public or other public health professionals, anything like that. And often we can get you articles without necessarily having to send you elsewhere. But as far as fostering and finding those partnerships, I'm really not so sure on that one, so I apologize.
That's great, thank you. Anybody else have any questions or things they want to share? maybe some examples of how you've identified some evidence-based research or information in your work, or how you've partnered with maybe some other entities to foster some of that as well. Well, I'll ask one more question, and unless anybody else chimes up, but what, I know you work with a lot of students, but what are some challenges or maybe some things that you see, professionals do wrong or miss the point or miss when they're looking for things like that? Are there, kind of those lessons learned or things maybe people are doing and they shouldn't be doing? Or
Right. One of the things is avoiding things like Pubmed, right? So I find that a lot of people, not just students, are really comfortable with like Google Scholar because they used it a lot, or they're comfortable with just Google and they don't want to change, and so they avoid Pubmed. And even if they have access to all of these great databases, they tend to avoid them because they're not familiar, they're not comfortable. So my biggest thing is, like, not that long ago, they changed Pubmed, and I still have faculty that are like, I don't like the new Pubmed. But it's been over a year, so it's time to start to get used to it, and kind of keep going and keep digging.
That's great feedback. And I think one of the other things that we've seen in our work is that maybe is just trying to, as you talked about before, the levels of evidence. And so one thing is we're trying to get the word out about what is evidence. So just because maybe something's done in a community doesn't mean it's, the evidence supports it across the way. So how do we get folks to really understand what truly evidence is, and use that to drive the work that they're doing as well. And a lot of that looking at the literature and things like that.
Yeah, that's one of those things where, everybody wants the best meta-analysis and the best systematic review and that sort of thing. And that's great if you can find them, if they are out there. If they are not out there, then you just kind of have to go back down that pyramid and just understand that, so it was done in a certain community. That does not necessarily mean that it's going to apply to all communities, but it means that there's probably an opportunity to see what can be done in your community, right? So maybe the evidence is not going to link directly, but what can you extrapolate from that, even though your community is dissimilar from the other one?
That's really great feedback. Thank you. Anybody else have any comments or questions for Timmy while we have her on? And she did share her contact information, and so I invite you to reach out to her if you don't already do that. I know I live in Sioux Falls, and if you haven't utilized the Wagner USD Health Sciences Library, it's a great resource. A lot of good information there. So
they are excellent. Excellent.
Well, we have a quite bunch today, so I think we can wrap up early, but just wanted to thank you for sharing your expertise to me, and really appreciate the insight. And again, she shared her contact information. Well, for those of you who have registered for the remaining Learning Collaborative, we do have one that'll be happening in September, one in November, and then one in January. And so the next one will be on adapting evidence-based interventions to your community. Invite you to register for those if you haven't already. We will be sending out an evaluation form after today, and invite you to reach out to any of us if you have ideas or concerns or questions really about what we can do to look at building that capacity of public health through some training opportunities as well. So with that, I will just say thank you, Timmy, for sharing your expertise again, and thank you everyone for participating today, and wish you a good rest of the week. So thank you all.
Thanks.